Hello and welcome to this module on disease outbreak response. I'm Dr. Nnamdi Moiteke with the Department of Community and Public Health at Idaho State University. At the end of this module, we expect participants to be able to understand and recall key public health concepts in outbreak response, early outbreak detection and rapid response strategies, including outbreak investigation, confirming and controlling outbreaks, how to adequately prepare at community, facility, district, regional, and national levels to support outbreak response, how to adequately respond at district, regional, and national levels, the principles of incident management and the incident command system, legal frameworks and policies and laws guiding outbreak response monitoring for decision-making, how to use effective risk communication and community engagement at all levels, including the communities at risk, and provide regular feedback using appropriate communication channels, and how to win public trust and getting people to talk and communicating with schools and so on during an outbreak. So we begin with the first unit of this module, which is preparation for outbreak response. It is one of the core capacities required by the international health regulations, talking about preparing for outbreaks. And this preparation enables the health system to function promptly, effectively, and efficiently to reduce significantly attributable deaths or disabilities. And preparedness is an essential role of all levels of the health system, including the local level, the states, and the nation as a whole. So there is need to develop a public health emergency preparedness and response plan, EPR. All levels must also establish public health emergency management committees and develop a functional public health emergency operations center, PHEOC. And furthermore, the public health authorities must identify and train key members of public health emergency management subcommittees, as well as the public health emergency rapid response team. So simulation exercises, such as tabletop exercises and drills, should be conducted periodically. And we should also establish a database of trained healthcare workers for such capacity and prepare hazard-specific contingency plans. The public health emergency response structures include the permanent functional public health emergency operations center, a functional public health emergency management committee that has technical members, as well as non-technical members who are stakeholders in the community. And this committee should be headed by the highest political office holder in the particular jurisdiction. So the public health emergency management subcommittees also should be in place, and the public health emergency rapid response team should also be set up. And we shall talk more about the functions of these various committees and teams shortly. So what is the Public Health Emergency Operations Center? It is a hub for the coordination of information and resources to support incidents or event management activities to respond to emergencies that involve health consequences and public health threats. So the Public Health Emergency Operations Center is important because, firstly, it facilitates effective coordination of response to public health events. It minimizes impact of any event in the community. It acts as a hub for preparedness activities and is a requirement of the International Health Regulations 2005 of the World Health Organization. And the functions of a Public Health Emergency Operations Center includes, among others, that it acts as a center for decision-making and coordination of public health events and emergencies. It monitors the events using various sources of data. And the Public Health Emergency Operations Center also facilitates and improves communication between public health and emergency management stakeholders. It facilitates coordination with multiple response partners and conducts trainings and simulation exercises and carries out routine and event-based surveillance activities and serves as a resource center for preparedness and response activities. The essential elements for complete functioning of the Public Health Emergency Operations Center include plans and procedures for operations, physical infrastructure, telecommunication technology and infrastructure, information systems to support informed decision-making, and trained human resources. The Public Health Emergency Operations Center uses the incident management system during public health emergencies. And incident management system is a standardized approach to managing and coordinating response by providing a common hierarchy for response by staff. We'll look more at these in a later unit of this module. So incident management system is represented by the Public Health Emergency Management Committee, the Public Health Emergency Management Subcommittees, and the Public Health Emergency Rapid Response Team. As we have already stated, these structures should be established at national, state, and local levels. So the Public Health Emergency Management Committee, we want to look at its activities before an outbreak. And so before an outbreak, this committee should meet periodically to regularly review the emergency preparedness and response plans, to exchange information on risk monitoring, and review these disease trends and update preparedness steps. And they should also review level of preparedness at the beginning of each epidemic season and monitor stocks of equipment for event investigation and response. And they should also share conclusions and recommendations of these meetings with respective committees at all levels, as well as organize simulation exercises and drills to test the emergency preparedness and response plans. In the event of an outbreak, the Public Health Emergency Management Committee should meet as soon as the outbreak is established and conduct situational analysis and grade the level of the event. They should quickly activate the Public Health Emergency Operations Center and deploy the Public Health Emergency Rapid Response Team to investigate and respond to the outbreak. They should also activate the Public Health Emergency Management Subcommittees. Also, during the outbreak, the Public Health Emergency Management Committee should assess need, request support from higher level, and meet at least daily at the beginning of the outbreak and weekly as the response continues. And they should regularly review outbreak response and take actions to improve outbreak control actions. And they should document and communicate outbreak response actions to next higher level, and as well as conduct after action reviews. Now we'll look at the Public Health Emergency Rapid Response Team. And the Public Health Emergency Rapid Response Team is a technical, multidisciplinary team that is readily available for quick mobilization and deployment in case of public health emergencies. And its main role is to investigate and initiate control of public health emergencies and events. And to reiterate, it should be established at the district, state, and national levels. So the composition of the Public Health Emergency and Rapid Response Team include case management and infection prevention and control experts, physicians, nurses, both clinical and public health, surveillance and contacts management experts, such as epidemiologists, disease control officers, and data managers. It also includes laboratory officers, communication experts, and water, sanitation, and hygiene experts, veterinary officers, wildlife officers, and environmental officers as may be needed. The key functions of the public health emergency rapid response team includes to investigate rumors and reported outbreaks, propose and initiate appropriate control measures to stop outbreaks, and coordinate rapid response actions with local and national authorities, partners, and other agencies, and conduct monitoring and evaluation of the effectiveness of control measures, as well as conduct risk assessments, including to determine if an outbreak is a potential public health emergency of international concern. The Public Health Emergency Rapid Response Team also prepares detailed investigation reports to share with the Public Health Emergency Committee and Management Committee. It also contributes to preparedness assessments and the final evaluation of any outbreak response. And it meets very regularly. It should meet very regularly during outbreaks and quarterly when there is no outbreak, as well as also participate in simulation exercises. Now we look at conducting risk mapping for outbreaks. So vulnerability, risk assessments, and mapping are used to aid preparedness. And this process identifies at-risk areas or populations. It ranks preparedness activities and engages key policy and operational partners. It is important to map and assess all risk in the catchment area with the potential to affect community health and potential epidemics. And so risk mapping should be done across all levels, national, regional, and district. For example, evaluating drinking water sources or food storage methods and animal breeding areas and movements. Risk mapping should also be done regularly and updated periodically, for example, once a year, to assess those risks and record the information on a map. Now we look at the emergency preparedness and response. The purpose of emergency preparedness and response plan is to strengthen the ability of the districts or the state or the nation as a whole to respond promptly when an acute outbreak or other public health event is detected. So there are key sections of the emergency preparedness and response plan. And this includes designated coordination structures, including the committees, the matrix of key stakeholders and partners supporting health activities and roles and responsibilities of each of these, the operational actions according to expected phases of the epidemic, the epidemiology and surveillance activities, including health information management, and then laboratory specimen collection, handling, transportation, processing, and information management, which make up part of the laboratory procedures that will be employed as part of handling the outbreak. And so considerations and protocols for case management, risk communication, and social mobilization, decontamination of patients and environment, and management of dead bodies are also part of the plan. Other components, other key sections include plans for capacity building and training, including simulations, like we've talked about before, and logistics, including supply lists and modalities to protect the environment, and mechanisms for monitoring the outbreak, and strategies for resource mobilization and procedures to reallocate resources. So what does it mean to set up a contingency stock of supplies as part of preparation for an outbreak in the future? And preparation and setting up of contingency supplies is important because outbreaks and other public health emergencies require the rapid mobilization of resources such as vaccines, medicines, and laboratory supplies. So what then should be done? Stockpiles of medicines, vaccines, reagents, and supplies should be established and pre-positioned at all levels before an emergency occurs. And we should have an efficient supply chain, which includes maintaining a reliable supply of these stocks and other materials, and ensuring quick centralized mechanisms of sending out these supplies when needed. And then there should be regular monitoring of contingency stock to avoid shortages and expiration of medicines, vaccines, reagents, and all other supplies. So in summary, being prepared can reduce the number of cases and deaths in a district when an outbreak occurs. So public health emergency preparedness and response structures like the Public Health Emergency Operations Center, Public Health Emergency Management Committees and subcommittees, and the Public Health Emergency Rapid Response Team should be established at local, state, and national levels before and during an outbreak. So developing and regularly testing an emergency preparedness and response plan strengthens the ability to respond to an outbreak. So maintaining proper essential emergency stocks of medicines, vaccines, reagents, and other supplies will reduce the turnaround time and eventually save lives. So knowledgeable and skilled frontline health workers are key to the success of any infectious disease outbreak response. Thank you.